This medication is used to relieve a dry cough caused by the common cold or other conditions as prescribed by your doctor. Relieving a cough helps you get more rest and sleep. This product contains two medications, Hydrocodone and Homatropine. Hydrocodone is an opioid cough suppressant that works in the brain to stop the urge to cough. Homatropine belongs to a class of drugs known as anticholinergics. This medication is generally used for short-term treatment and should not be used for ongoing coughs from smoking or long-term breathing problems, unless directed by your doctor. Opioid cough suppressants should not be used by children younger than 18 years. Children are at higher risk for serious side effects, especially breathing problems. Talk with the doctor about the risks and benefits of this medication. Cough and cold products do not cure colds. Cough due to a common cold often does not need to be treated with medicine. Ask your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drop/spray. Before taking Hycodan, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food every 4 to 6 hours as needed, as directed by your doctor. The dosage is based on your medical condition and response to treatment. The manufacturer recommends that adults should not take more than 6 tablets or 6 teaspoons, 30 milliliters, daily. If you are taking the syrup, carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. If you suddenly stop using this medication, you may have withdrawal symptoms. To help prevent withdrawal, your doctor may lower your dose slowly. Withdrawal is more likely if you have used this medication for a long time or in high doses. Though it helps many people, this medication has a risk for abuse and may sometimes cause addiction. This risk may be higher if you have a substance use disorder. Take this medication exactly as prescribed to lower the risk of addiction. When taken for a long time, this medication may not work as well and may require different dosing. Tell your doctor if this medication stops working well. Lastly, tell your doctor if your cough does not get better in 5 days. If you experience nausea when taking Hycodan, it may decrease after the first few doses. You can try taking it with food and lying down for 1 to 2 hours with as little head movement as possible to decrease the feeling of nausea. Some common side effects of Hycodan include lightheadedness, dizziness, drowsiness, vomiting, and constipation. If these effects persist or worsen, it's important to consult your doctor or pharmacist. To prevent constipation, make sure to eat enough dietary fiber, drink plenty of water, and exercise. You may also need to take a laxative, so ask your pharmacist which type is right for you. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. Serious side effects are rare, but if you experience interrupted breathing during sleep, stomach/abdominal pain, mental/mood changes, or difficult/painful urination, be sure to tell your doctor right away. In the case of very serious side effects such as eye pain/swelling/redness, vision changes, slow/shallow/irregular breathing, severe drowsiness, seizure, fainting, or signs of a serious allergic reaction, it's important to seek medical help immediately. Keep in mind that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. When taking Hycodan with Homatropine oral syrup, it's important to be aware of the potential risks and side effects. This medication has a risk for abuse and addiction, which can lead to overdose and even death. It may also cause severe breathing problems, especially when starting the medication or taking the wrong dose. It's crucial to follow your doctor's instructions and take the smallest effective dose for the shortest possible time to lower your risk. Avoid taking this medication with alcohol or other drugs that can cause drowsiness or breathing problems, as it can lead to serious side effects, including death. Additionally, it's important to keep this medicine in a safe place to prevent theft, misuse, or abuse. If someone accidentally swallows this drug, seek medical help immediately. For women of childbearing age, it's essential to discuss the risks and benefits with your doctor before using this medication. It's not recommended during pregnancy as it may increase the risk of birth defects, especially if used during the first 2 months of pregnancy. Using it for a long time or in high doses near the expected delivery date may also harm the unborn baby. Babies born to mothers who use this drug for a long time may develop severe withdrawal symptoms, so it's important to seek medical attention if you notice any unusual symptoms in your newborn baby. Before taking this medication, it's important to let your doctor or pharmacist know if you have any allergies to hydrocodone, Homatropine, or other opioid medications. This syrup may contain inactive ingredients that could cause allergic reactions or other problems, so it's best to have a conversation with your pharmacist for more details. Before using this medication, be sure to inform your doctor or pharmacist about your medical history, especially if you have any brain disorders, breathing problems, gallbladder disease, kidney disease, liver disease, mental/mood disorders, history of substance use disorder, stomach/intestinal problems, pancreatitis, difficulty urinating, family history of glaucoma, adrenal gland problems, recent surgery, or underactive thyroid. It's important to note that this medication may cause dizziness, drowsiness, or blurred vision. It's best to avoid alcohol or marijuana, as they can increase these effects. Refrain from driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. If you use marijuana, it's recommended to have a conversation with your doctor. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially confusion, dizziness, drowsiness, and slow/shallow breathing. If you are pregnant or think you may be pregnant, it's important to talk to your doctor about the risks and benefits of this medication. This product is not recommended during pregnancy as it may harm an unborn baby. Additionally, this product passes into breast milk and may have undesirable effects on a nursing infant. It's best to consult your doctor before breastfeeding while using this product. It's important to be aware of potential drug interactions that could affect how Hycodan works in your body. Some medications, such as certain pain relievers, potassium tablets, and drugs for sleep or anxiety, may interact with Hycodan and increase the risk of serious side effects. It's important to talk to your doctor or pharmacist about all the products you use, including prescription and non-prescription drugs, to ensure they won't cause any adverse effects when taken with Hycodan. Additionally, it's important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. This includes allergy or cough and cold products. It's a good idea to consult with your pharmacist to make sure you can use these products safely while taking Hycodan. Furthermore, certain medications can affect how your body removes Hycodan, potentially impacting how it works in your system. Examples of these medications include certain antibiotics, HIV medications, and drugs used to treat seizures. It's important to discuss any potential interactions with your doctor to ensure Hycodan will work effectively for you. Lastly, it's important to be aware that Hycodan may interfere with certain lab tests, possibly causing false results. Make sure to inform all lab personnel and your doctors that you are using this medication to avoid any issues with test results. If you or someone else has taken too much Hycodan, with Homatropine, oral syrup and is experiencing severe symptoms like fainting or difficulty breathing, call 911 right away. Otherwise, contact a poison control center immediately. In the U.S., you can call 1-800-222-1222 to reach your local poison control center. Canadian residents can call a provincial poison control center. Signs of an overdose may include slow breathing, slow heartbeat, cold or clammy skin, and loss of consciousness. It's important not to share this medication with others, as doing so is against the law. This medication has been prescribed specifically for your current condition, so it's crucial not to use it for another condition in the future unless your doctor instructs you to do so. In those cases, a different medication may be necessary. If you happen to forget a dose, take it as soon as you recall. If it's close to the time for your next dose, just skip the missed one. Stick to your regular schedule for the next dose and avoid taking a double dose to make up for the missed one. When storing Hycodan, with Homatropine, 5 mg, 1.5 mg/5 ml oral syrup, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a safe place away from children and pets. When you no longer need the medication or it's expired, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Avoid flushing the medication down the toilet or pouring it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.